Dr. Swaminathan, very good to speak to you. We've all been looking closely this week at the AstraZeneca numbers and results. Do you have any thoughts on why it seems to be the case that this vaccine works better in an initial small dose? Could that conceptually make sense to you?
Yes, thank you for that question. It is intriguing, indeed, very intriguing. And I can't say that we absolutely know why. I don't think that the investigators fully understand it either. But it does hint that it's potentially possible to use a lower dose. And there could be a couple of reasons, like, you prime the immune system, you prime T cells and then come back with a bigger dose, and then the immune system responds better. It's also possible that because this is an adenoviral vector, which itself might raise antibodies to the adenovirus, that a smaller dose of that is actually working better. But I should add that we first need to see the whole data set, because I think this analysis that was released yesterday, very encouraging, very promising, but combines two different kinds of studies. And the study using the half dose and the full dose was actually based on less than 3,000 patients, subjects. And so I think we really need to wait for larger numbers, longer follow-up, to see whether these differences actually continue in the future. And then certainly scientists will be looking to see why this might be the case.
Some of our reporting, Dr. Swaminathan, also suggests, this is in conversation with the Warp Speed chief in the United States, suggests that the AstraZeneca vaccine could stop those who do still get COVID from getting severe COVID. Have you seen data that supports that? Would that be an exciting development?
That would be, because major goal of vaccination is to reduce the mortality, to prevent as many deaths as possible. And then, of course, to reduce transmission to the point that this infection basically is unable to transmit human to human. Now, on both of these, we're looking to see more data. We did hear that none of the people who got the vaccine developed severe disease or needed hospitalization. Again, that's very good news. And we don't have as much data yet about transmission, but again, there is some hint that because there did not seem to be any or many cases of asymptomatic infection, because people were swabbing themselves every week, apparently, to find if there were asymptomatic infections going on. That seems to have been quite low as well. So indeed, if this vaccine prevents severe disease and prevents transmission, then that would be very good news.
So that could be very positive. You've previously said, Doctor, that it would take 2 years to vaccinate the whole population, but maybe you don't need everybody to be vaccinated to prevent this being a pandemic, to produce some immunity in the population as a whole. How long do you think we will have to be with a pandemic as defined by the WHO?
Well, we know that we need to vaccinate a significant proportion of the population to develop, population immunity, or sometimes called herd immunity. That may be 60, 70%. Again, this is going to change as the epidemiology changes. But that's still a lot of people. It's 5 billion people. So we're going to start with vaccinating high-risk groups, people who are vulnerable to the infection, like the frontline workers and healthcare workers, and also people who are at highest risk of dying, the elderly, people with comorbidities and other immune system dysfunctions. That's the priority for 2021. I'm talking about global priority, and that's what the COVAX facility aims to do, to deliver 2 billion doses of the vaccine by the end of 2021 to at least cover this population that's at most risk. And then by the end of next year, we should have much more vaccine available to rapidly start vaccinating the general population. So I think for the next year or so, we are going to have to keep in place some of the measures or restrictions, you might call them, that we've got used to this year, because till the vaccine gets into enough people to actually start blocking transmission in the community, there's still going to be chances of people getting infected and getting ill. So it's going to be a gradual process.
And as we see those... Okay. So it's a gradual process. As we see those vaccines rolled out, Doctor, what words would you give to medical authorities if they come up against vaccine hesitancy in any part of the world? What should vaccinating authorities do then?
Well, I think, one of the good things may be that since we're going to be vaccinating healthcare workers first, they're definitely at the front line at the highest risk of getting infection. They're the people who've really borne the brunt of this pandemic, both in terms of lives lost, but also in terms of just the hard work that they've been called upon to do. That should build trust in the community. If you have your doctors and nurses in your local facilities being the first ones to take the vaccine, then that should build some trust in people who might otherwise have doubts. I mean, people have genuine questions about the process of development, especially because it's been so fast and everything's been so much in the news all the time. So it will require explanation. It will require answering questions. It will require listening to people and their concerns. And I think we shouldn't jump to the conclusion that everybody who's hesitant is an anti-vax person. No, it may be just that they need to understand better, that they have questions that they need asked. And very often, we find that it's lack of access to vaccines that prevents people from getting vaccines. Certainly in many countries around the world, it's not that people don't want their children to be vaccinated. It's just that it's logistically so difficult for them. So I think it's contextual. But what is needed is that public health leaders have start having this conversation with people, with the communities.
Okay. So have those conversations. Just finally, can I ask you, as we sit here at the end of November, going into December, many parts of Europe gearing up for holiday season, for Christmas vacation, do you have any words of advice as to how much Europe should loosen or tighten regulations as we head towards that period?
Well, I do think that we have to be extremely careful. We've seen what's happened in the last few weeks, how this virus can really take off. And once it gets into an exponential growth phase, it's really, really difficult to control it again. So it would be extremely risky, I think, at this point, to loosen restrictions and allow people to act in a manner that they would have if there was no pandemic. I think that would result in terrible consequences. So I think both governments, but also individuals and families need to think about how they're going to celebrate the holiday season this time. Do they really need those big gatherings? Do they really need to travel? Can you do smaller groups, people who are already in bubbles? Can you do as much as possible outdoors? Could you wear masks all the time as much as possible? The moment you put a number of people coming from a number of different areas in a room, you increase risk. And families that have vulnerable individuals, that have older individuals, particularly should be thinking about whether big family gatherings should be had this festive season.